Hey everyone, and welcome to The Care Connection, SMC's podcast where we bring you top-tier care from people you trust. I'm your host, Chelsea, the marketing manager here at SMC. Each episode will dive into everything rural healthcare and more, the challenges, the wins, the people, and the stories that don't always make the headlines. This is your backstage pass to see SMC in a more unfiltered light, straight from the folks who live and breathe this work every day. Whether you're a patient, a neighbor, or just healthcare curious, we're glad you're here. So let's get into it. This week's guest is Dr. Mo Abdi. He is our radiation oncologist at the Robert S. Holmes Cancer Center here at SMC. Well, thank you, Dr. Mo, for giving me an hour of your time. Do you want to tell us a little bit about yourself and how you kind of got into radiation oncology and what led you here?
Yeah, my name is Mo Abdi, MD. I'm a radiation oncologist here at Shenandoah Cancer Center. This is my 7th year working overall as an oncologist. Practicing oncologist, time goes really fast. 3rd year here at Shenandoah in July. I never really was meaning to go into medicine, to be honest with you. I was in biomedical engineering in undergrad with specialization in physics with aims of going to space, basically.
Oh, that's really cool.
Yeah. I was in a program doing that and at McMaster University in Canada. And it was very interesting. And at that time, we were doing a lot of nuclear medicine, a lot of physics. And at that time, I got to see the Department of Radiation Oncology with that academic center because we were working closely with them with physics, medical physics, with one of the courses I was in. And I thought it was pretty cool, the job they're doing, looking at their physics stuff and working on their math problems. And at the same time, dealing with people and technology. And it's a pretty niche field in medicine. I thought it was quite interesting, kind of piqued my interest. And when I was in my undergrad, I applied for a PhD program. And I was like, why the hell? Just apply for a couple of med schools. I only applied to three med schools. And here I am. So that's...
That's awesome.
Yeah, that's my story of getting into oncology.
Awesome. Okay, so I have not necessarily space story, but so do you like sci-fi things?
Oh, 100%.
Of that?
See?
Oh, yes. Star Wars.
You can see behind me.
I love it.
Yeah.
I love it. Did you read Project Hail Mary?
Yes. Read Project Hail Mary, watched the movie. Great movie. Really liked how they actually use real life science into it, and that not all aliens potentially would look like us or communicate like us.
I love that too. Yeah. I was really happy when I actually read Project Hail Mary of like the way that they like did the math and like described it and everything. I'm like, I understand it. Am I smart? Does this mean I could do this? They did it in a way. So that's really cool. Okay, sorry, the squirrel moment.
No. I like that, and I like Arthur C. Clarke, the Foundation series, and all that sci-fi books. That's what I grew up around. I remember by the age of 12, I read all the sci-fi books at my local library in Ottawa, Ontario, where I grew up.
That's awesome. That's awesome.
Yeah.
Does working at the Cancer Center here at SMC change the experience for you and how you think about treatment of cancer and radiation oncology?
Yeah, 100% for sure. So I was trained at a large academic center where we had 40 practicing radiation oncologists, and the complement staff was close to 100, including radiation therapists, physicists, and you can refer to any specialist you wanted at any moment of the day. I left that and I went to a large hospital system in North Iowa, which had a lot of resources. They had their own ENT, neurosurgery, most specialist departments. We had a small interruption there for a case that Dr. Mo was called to, which is really interesting, and we'll talk a little bit about that.
So we just got back from like a
CT sim of a lung case.
Yes.
So the day-to-day of a radiation oncologist is very varied, and one of the things you will do is see patients that need their lungs scanned, identify the tumor, and then start their treatments. And it happens throughout the day, so I get randomly called even if it's lunchtime. So that happens all the time.
So you're just, like I said downstairs, just plot twists left and right. You never know what your day is actually going to include.
Yeah, it's very varied, to be honest, compared to most physicians. You're not in your clinic all day, seeing patients or just sitting down behind a computer screen. We do a little bit of physics. We do a little bit of dosimetry. These are computer items. We do a little bit of helping set up patients for radiation, which we just saw downstairs in our X-ray department. We start the patients on the machines themselves, the Linacs. We go up there to make sure the setup is good. Sometimes we see patients in the nuclear medicine department as well. And sometimes we get consults from other doctors along the way in the hallways, or sometimes we see patients in the clinic. So some doctor might call me from the skin clinic and I go there to look at a lesion in their skin, see if there's something we can do for them. So it's quite varied.
Just all over the place.
Yeah.
That's awesome.
Yeah.
I'm just going to ask you this again because we kind of got interrupted last time. How does working in the cancer center here at SMC change the experience for patients in Shenandoah and the surrounding rural areas who would otherwise have to travel for treatment in other places?
So that has a couple answers. You know, a rural oncology center has different challenges than an academic center or a center in a city, and also advantages for the people as well, to be honest with you. Challenges are, you don't have access to tools or specialists that typically are in a larger academic center right away. There's different ways of mitigating that. You know, telehealth and being able to call, and technology has eased a lot of those concerns. Benefits is that people are from your town most likely, or you guys know each other, or it's like a small town feel, small town vibe with every single case. You know, we don't see you just as another number going through the academic center. So that's a big advantage being in a rural center.
Nice. And do you think it's better for patients to, say they're only 30 minutes from Shenandoah to get treatment, but they're, an hour and a half away from Omaha? Does it make sense in your head to just come here?
Oh, 100% makes a big difference. Like, let's say if you're a breast patient getting 20 treatments for your breast for radiation, imagine being on the road 3 or 4 hours every day compared to maybe an hour sometimes, or even less if you're from in town. 30 minutes.
Right.
A big quality of life difference, especially if you have a more advanced stage or metastatic, and quality of life is a big focus. Spending half your day on the road, while you're sick and not feeling well is not, something a lot of people don't want to do.
Right. I would agree with that. What are the biggest challenges in delivering advanced radiation therapy in a rural setting, and what unique advantages come along with this tight-knit community?
Right. So resources are always a challenge. You don't have everybody you need because obviously we live in a smaller town.
Yeah.
It's rural, right?
Yeah.
So you just have to make sure everybody's cross-trained. We all wear different hats, do different things. I'm always on call, which is great because I cover my own patients. I don't rely on a third party. To check on my patients. I give them my number. I wouldn't be doing that if I was in a city. I don't know where my numbers would go. People are polite and respectful of my time too. But it's just like the resources challenge, but we mitigate that using technology. We leverage technology to do that, and different flexibility tools we employ. But really, we just have to be creative, think outside the box, and be able to deliver quality care at academic level setting to a rural setting. Then there's the financial concerns. Thank God I don't have to worry about that. There's Matt and others that have to deal with that. In a rural setting, it comes with its own challenges in making sure the institution stays afloat financially, because there's a different dynamics at play here compared to if you were at a city or academic center that have a bigger support network.
Correct. Yeah. I think that is a very I don't want to say hot topic, but it's one of those topics that people don't know a lot about, because I think a lot of people have this idea that all hospitals and all, places of care get all of this money from the government. And it's like, that's not true at all. Like SMC is a nonprofit. And so basically it's designed as like a community hospital. So any revenue that's made is turned around and put back into the hospital. There's no extra funds coming from anywhere unless we get a grant, or our foundation office is able to come up with something for us. So that is an area that I think people don't know a ton about, and thinking that like, oh well, my taxes go to pay for this. They don't come to the SMC directly. Like if we have any kind of grant from the government or anything, that's something that we have to apply for and show that we actually have need. So it is a different realm than being at a academic hospital or a big city hospital.
Oh, definitely, for sure. And there's more challenges financially because everything costs more to deliver in a rural setting, right? Well, you might be actually getting less, or maybe slightly a little bit more, depending on different programs that are out there to help rural programs, rural hospitals. But really, if you look at the statistics, rural hospitals are closing down left and right.
Mm-hmm.
Every year there's less and less rural hospitals because economically it's very difficult to keep them afloat because of the constraints, physical constraints that are out there. Obviously, it doesn't have to be this way. There's different ways of addressing these concerns, but it takes a lot of effort, and that's what our team does here to make sure our hospital is working. Matt and others really appreciate all the hard work they're doing to make sure our institution is heading the right direction and making sure it's supported financially appropriately and being a good steward of the resources we have.
High praise to all of them. Cancer is never solo. How do you collaborate with surgeons, medical oncologists, nurses, support staff at SMC to create kind of a patient-centered treatment plan?
So oncology is like the Olympics of medicine because the number of different specialties that are involved varies a lot. I'll give you a head and neck cancer case. So you have the head and neck doctor as well, the surgeon, the primary care, the pathologist, the radiologist, the radiation oncologist, the medical oncologist, the nurses, every single different subspecialty that we just mentioned involved, plus their coordinating staff and social workers and hearing doctors as well, and sometimes neurosurgeons as well, just involved for that single case. So you might have a team of 20 for just a single patient. And you all have to share notes, you all have to share sometimes resources, and kind of collaboratively work together to deliver the best care. And I'll be honest with you, sometimes that's very challenging, getting and centralizing all that information from all those different specialties and making sure everybody's rowing in the same direction. So that's some challenges that we have. And it's not us here, but it's everywhere with oncology, right? But what we do is we make sure everybody's are on the same page, and I usually talk to all the other doctors that are involved in the care. We all make sure that we're going towards the same goal for the patient, obviously, and then we kind of act on that plan, and then we kind of pass the baton to each other at the different levels of care, and we all have our follow-ups with the patient. To make sure that the patient is heading the right direction. And that's typically how we operate.
Nice. Would you say from working in a bigger hospital setting to here, is it easier on a rural setting because you have more of a, you see these people more face to face, or was it easier at a bigger setting?
I would say it's easier at a bigger setting, I'll be honest with you, because you have tumor boards and more staff helping you to make sure this collaboration happens. But what's easier at a smaller center is I just walk around and talk to everybody involved locally in the patient's care. And I know them and I see the same faces, and I'm not seeing a different face every time.
Right.
So it makes it easier to actually provide the care that we do provide locally, especially when I work with my Dr. Breyer, who's my other arm here at the cancer center, and Dr. Rose. When we do treatments here together, it's very smooth and goes very easily because we're all close to each other. But when it comes to more complex care, like a brain cancer patient who's getting surgery at the academic center, followed by radiation here and a chemo by Dr. Breyer or somebody else, it just adds more complexifiers from a local, providing it in a cogent manner compared to if everything was done at the academic center. But we communicate enough that we make it happen here.
Awesome. That's good to know. I'm sure that answers a lot of questions. I think people generally, when they first get that cancer diagnosis, the first thing is just fear of, what comes next, what's going to happen to me. There's so many unknowns. So knowing that you're in a place where, like, don't worry, the whole team's on it. Everybody will talk to each other. You will be the center of the treatment plan. Everything will work for your best interest.
I'll tell you, I feel like I'm just a communications director. Most of my day is spent communicating between different doctors and different staff, to be honest. I spend a couple hours on that every day, just to make sure we're all on the same page. And it's pretty routine. Everybody does that.
Yeah.
Just making sure we communicate appropriately to the other parties involved in the patient's care.
That makes sense. That's probably the best way to get everything done. You kind of have to be that liaison almost between what you're doing and what they're doing and what the patient needs.
Right.
Makes sense.
Yeah.
Radiation therapy involves complex technology, which we talked a little bit about. How do you balance that cutting edge treatment with the personal emotional support patients need?
Right. That's the thing with radiation oncology. Not only are you dealing with Star Trek, Star Wars level of technology, to be honest with you, daily worrying about if you're, working with the right photons, right energies, right electrons, right energies, and so forth. stuff that most people don't even think about, to be honest with you.
Yeah.
But it's really fun. But you also have to be thinking about, which is very, very important to me, about how the person is feeling. Make sure they feel safe, making sure they feel addressed, and make sure that they feel that they're heard. This is something that I try to pay attention to every single patient that I work with every day, because these patients, even though we see tens of patients every day, for the patient from their end, it's their first time.
Yeah.
And we have to remember that, and we can't forget that. All right. So I make sure that they know why they're here, to make sure they know what we can and can't do for them. Both are important, what we can do for them and what we can do for them here. And then making sure they get as much appropriate care as they can. I really do feel cancer patients globally in our country don't get the care they deserve, and the compassion and the support that they need. And we try here at Shenandoah to give as much as we can that we can give locally, in terms of what we can provide for them. So we balance those two. We balance the personal touch and care, and compassion and kindness, with making sure they get the latest technology available to make sure that they get the best cure rates and the best treatments possible.
I actually, when I walked up here, I got to see that firsthand, because right before our interview started, a gentleman had his final chemotherapy session, and he was like officially done. And so everybody lined up on the hallway, and they had their little pom-poms, and they were playing a really awesome song, and he got to go out and ring the bell that, his treatment was over. So I think it's those little things that just add that extra, like, you are a neighbor and we care about you and we want you to feel good and we want you to be healthy. And it was a beautiful little touch that I was like, what a great thing to witness right before we did this interview. It was really cool.
Yeah, we love doing that. It's fun, because patients almost become part of family. We see them every day for a month at a time, sometimes years at a time. So I want to be with them for these milestones and celebrate them as they go through them.
Yeah, absolutely. It was a beautiful moment to see. I was really, really happy that it just worked out perfectly, that I walked up here right when that was happening.
That's amazing.
It was really awesome. I was like, I almost teared up in it. I was like, this is so sweet. The Cancer Center makes a huge impact for this region. What does it mean to you to bring that level of care locally, and what difference have you seen in patients and families?
My goal from the get-go is to deliver the same treatments that are available at the academic center here, so the patient doesn't have to spend 2 to 3 hours of their day in transport, especially if they don't have much time to live.
Yeah.
Right? And we've done that. We've started the obviously the program here, so they don't have to go elsewhere with the newest machine, one of the newest machines in the state.
Yeah.
And then we went on to deliver, SBRT to the lungs, to make sure that they can get them here rather than going elsewhere, which they were before, so they don't have to go. A lot of small centers don't deliver those treatments, but we're able to do that here. Then we went on to deliver the same high-tech SBRT treatments for small brain lesions, and we've done dozens of them here, successfully, and patients are doing well rather than going to a bigger complex center like Mayo or Texas. And now we're also delivering like liquid radiation, which is even more rare to deliver at a local setting. There's only a handful in the country, and we're one of those as well. They're called, theranostics. Basically, we deliver radiation to target the molecule exactly. We're the leading edge of that, and we've treated, 2 or 3 patients, and we're probably going to be treating more and more, to be honest with you, as we get more indications for these treatments, and we're ahead of the curve for that.
That's super awesome.
So yeah, we're really excited for that. They don't have to go to an academic center or a private center or a bigger center to get those care. They can get them right here. We make sure we have the best imaging possible as well, and I continue to push for technologies and ideas and things that I feel will keep our patients here so they don't have to go elsewhere. So that's a big focus that I personally do.
Yeah, that's awesome. Now, with the theranostics, what kind of cancers would those specifically treat?
I'll tell you, the first cases is like metastatic prostate that goes to the bones and everywhere. There is therapies, drugs that we can give that have the radiation attached to it to deal with that. Patients who have neuroendocrine tumors, kind of a rare tumor to be honest, when it gets metastatic, this gives you honestly a long life, these treatments, and make you live at home, best quality life possible. Actively treating patients for both of those right now, they get them once every few weeks. They come back and they get their infusion. We have our whole team, the radiation team, the therapists, the nurses, the doctors, the physicists, all involved in the care, and we deliver in the community, and the patient just goes right back home. They don't have to go 2 hours each way, go to Mayo or somewhere else for that. And we'll continue to expand the indications for those as they come online.
Yeah. That's really awesome. That's really, really cool. It's crazy to me to think that Shenandoah has like one of the only ones in the country. Like, that's crazy.
Yeah, most people are honestly, they're just scared. It's too complex, or you just have to do a lot of thinking around it. But I enjoy that. I still do research. I still involved with research a couple of journals and continue to make sure I'm up to date on that. And I really enjoy that. So I just kind of push the envelope. And, I appreciate the Shenandoah Medical Center supporting us to make sure we deliver it, because it involves challenges from their end too.
Yeah.
Making sure we get covered appropriately in terms of from the pharmacy side, in terms of having the drugs available, in terms of having the different representatives come through our center and just keeping the doors open. And I really appreciate that, because it enables us to continue to deliver these kind of therapies here.
That's awesome. That's really, really cool. I'm sure people are going to be super excited to know about that.
Yeah.
I'm going to go off topic here just a little bit.
Sure.
So we've talked a ton about like radiation and all of these things. We talked a little bit earlier about the things that you like to do, but what do you think kind of led you or kind of pushed you to say, like, it was really cool to see all the, space things, and you're really into that. But what do you think, was there like a one specific moment that you were like, this is it?
I'll be honest with you, I spent 2 months with a radiation doctor in McMaster University, and I liked how much research they were doing and how varied their life was and how up to date the technology was. Like, this is about 15 years ago. I can't believe it. 18 years ago when I first saw this. Goes by fast. But the technology has changed so much since then. Let's put it that way. And I just wanted to be part of that, and I thought it would help me. I'll be honest with you. There's a few type of doctors NASA accepts, and one of them is like the nuclear medicine, space aeronautics doctors. And I thought I could do two things at once, and that's why I pursued that route.
That's awesome. That's awesome. I didn't know if you had like some people I've talked to have like one case in particular that it was just like, that's what changed their mind. But it's really cool to see like the research side of that too. I think people forget that, if you become a physician, you're not always just a physician to be, in a clinical setting, in a clinic, taking care of, people coming in for their yearly checkups. Like, there's a whole other side of like what you do, radiation oncology. There's other studies you can do, research you can dive into. So it's interesting to open that door.
Yeah, like that one from 2 years ago. It was like a checklist for radiation therapists got published. It helps residents go through a checklist as they, from scanning a patient, just like we saw about 20 minutes ago downstairs, to what steps to take. Like, it looks kind of automated, but there's checklist I'm doing in my head to make sure the staff is going through while we're doing that. And it kind of published the first of those checklists, got published, and a lot of students use it across the country, both in the US and Canada right now.
That's really, really cool. Yeah. When a patient comes in, do you kind of have like what their day is going to look like when they first come in for an appointment with you, or does it change based on?
It's mostly the same. If it's a consult, they come in, they see my nurses, our wonderful nurses here. They get, their vitals taken, oxygen saturation, their heart rate, blood pressure, which is great because sometimes we find problems and we solve them right away. And then they get to see me for the consult. We go through all the reports from the different doctors, the radiologist, the pathologist, the surgeon, the ENT, and others. And then we go over what the treatment plan will be. And then they see my nurses again to kind of schedule their next appointments. And that's a very typical first appointment for a patient here. There's other stuff, they check in on the front desk, right? They see our wonderful staff there and meet with them. They might see other people depending on what their diagnosis is. If they're having dietary issues, see our dietitian. If they need counseling, see our counselor. If they have financial issues, see someone from our financial office. So there's other ancillary staff that they potentially meet during this initial consult. So that's their typical consult. Then the next type of visit is a follow-up, where a patient is on treatment and finished, and they need survivorship, it's called. They're followed up after they're done their treatments. And what we do is we see them with their imaging results. If they had biopsies or scopes, they come and they go through the front desk, see our check-in staff. get brought in to the room, see our nurses again who do the vitals, and then I do the follow-up with them. I review the images, tell them they're still in remission, their cancer is still not there, and order any further studies I have to order. And then they see another nurse of ours, and then we see them down the road. So that's a typical follow-up. And the third type of meeting is on-treatment meeting while they're getting active treatment. So their patient is being actively treated for their cancer, sometimes with radiation alone, more commonly with radiation with chemo, potentially with immunotherapy. Usually this happens once a week on Mondays for us now. The patient is seen, over a period of 10 to 30 minutes where we discuss about their side effects from treatment, any questions that they may have, give them medications or balms they need for their side effect, and prescriptions as needed. So these patients, sometimes I see them for 6-7 weeks in a row. So we get to know each other really well. We talk about a lot of stuff. One of them I actually recently adopted a dog from last week.
Oh, cute.
Yeah, so this patient, she knew we needed a dog, and we've been talking about it back and forth for the past year and a half. And we finally found a dog that was there. It was at the pound for a year, it looked like, an older dog, but my wife likes the older dogs, and seems like hopefully he barks the coyotes away, protects the chickens at our hobby farm. So we picked him up. His name's Count Chocula. He's a brown lab.
Count Chocula, that's so cute. Oh my gosh.
Yeah. So, and some of my other patients I bought sheep from, got farming advice, got where to get hay from. Some of them I get hay from for other livestock. So we get to know them. They become like family and friends, very close.
It's like caring for your neighbors.
Yeah. And we kind of keep each other, keep in touch over phone, over text, and besides the visits, right?
Right.
And you get to know them as a
Yeah.
human being, because you're not your diagnosis. You're a full human being.
I like that. You're not your diagnosis.
Yeah, you're not your diagnosis. So that's the wonderful aspect of radiation oncology. And we get to know our staff. We get to know our patients really well. And sometimes they bring treats as well, which is great.
Wonderful.
Yeah.
Now, when you are doing these appointments that have the ongoing, they're still going through their treatment, is there something that people are like more concerned about or scared about when they come in for those appointments that you're like, don't worry, this is not a big deal? Are there certain things that pop up more than often?
Patients at the beginning are very scared. They got a cancer diagnosis. Somebody else told them. I don't know how much information they have. I would say more than half come here, or even more, without knowing what stage they're at. So I'm the first person to tell them what their stage is, sometimes their life expectancy. It's a big deal, right? I've noticed some of the most scary aspect from the patient's perspective, looking, I try to put them in their shoes. They don't know what's going on. They don't have all the pieces of information. They've seen many other specialists, many biopsy and imaging, and I'm the one who's putting together what their stage, what their diagnosis is, what their treatment plans and options are. Some of them come in scared, naturally so, which makes sense. You would too, if you were in their shoes, right? So that's when I notice they're scared. There's some patients too, when they're getting their radiation, they're like, am I going to be radioactive? And they're afraid of that for their kids or their pets. No, you're not going to be radioactive, especially if you get the one from the external being. There's some others that we do, which might make you radioactive, quote unquote, in common parlance, but it's very limited, and we let you know when you have those treatments. Those are the radiopharmaceutics that we give patients that we've talked about previously.
Right. Okay.
And that's sometimes it's really funny, to be honest. None of them ever were radioactive, to be honest, and just telling them they're not going to be Superman or some kryptonite infested person. That's another question we typically talk about.
That's good. That's a good thing to debunk, because that is, I think, something that a lot of people would be worried about.
Right.
Oh, I'm getting this treatment. I'm literally getting radiation in my body. Is it going to affect the people that I love, the people that are around me, caring for me?
Right. And even another question that relates to that is, am I going to have burns? We don't get radiation burns. Maybe in the 50s and 60s, but not anymore. Yeah, some people who get skin treatments might notice redness and, maybe a mild sunburn-like reaction, but nobody really gets these burns or issues which we had many decades ago. The technology has advanced so far, the side effects are actually quite minimal, I would say. not because I'm only a radiation oncologist, compared to the three legs of cancer treatments, one being the surgery, the other being systemic therapy, and the third one being radiation. Radiation is the most mildest of the three cancer treatment options. You're not getting, you're not going to lose your hair. You're not going to, be super weak and fatigued. You're not going to be a potential risk for major infection or losing parts of your body or have surgical risk, right? So patients actually do really well with radiation.
Do you think people commonly don't want to go to radiation because they are they don't know enough about it, they're afraid of it, versus oh, if I have a tumor, I'm just going to have, the surgery and they'll take the cancer out?
Yeah, most people, they don't know how cancer works. They're like, just get it out, just have a surgery. I don't want to deal with it. But some tumors you don't treat with with surgery, and vice versa. And some people are not surgical candidates, right? So really, the biggest fear, it's not always that I see this, is just that they just want to have the cancer out, cut out and just not deal with it and just run away from it. But sometimes that's not an option, unfortunately.
In your professional opinion, do you feel like as a medical community, we're moving more towards a radiation geared treatment plan versus doing chemo or doing surgical?
I think things are changing for both surgery, systemic therapy, and radiation. We all work together. 1 in 2 patients who gets cancer eventually gets radiation. That's a fact. So half the cancer patients will sometime in their diagnosis will be getting radiation. Another fact, technology is advancing. We're seeing less extensive surgeries and more preservation of organs and limbs and body parts by using a combination of radiation and systemic therapy. We see that for breast cancer. Before, you had to have significant surgery for that, where they remove the whole skin, whole breast, the muscle, sometimes the bones in your rib, very disfiguring. Now they just remove the tumor, leave your breast as it is, send you to radiation to treat the microscopic tissue around it. So we see that kind of advances. Even radiation itself, how it's delivered, is changing. A lot of it for the longest time has been externally delivered using our LINAC. Some centers, they do use brachytherapy, which can be internally delivered as well during surgery or after surgery or on a standalone basis. However, we're also seeing now we're delivering more and more radiopharmaceutics, liquid radiation, right through your blood vessel, targeted at your cells that are cancerous. I expect to see more of that in the next couple of years, in the next 5 years, for sure, in the next 10 years. And yes, there will still be a role for the LINAC, the linear accelerator, the big multi-million-dollar device that we use to give you radiation from the outside, which delivers both, photons and electrons, at some centers protons. But we'll be seeing more of this radiopharmaceutics being used to treat cancers, which almost looks like chemotherapy because it's through the blood IV, but it's actually radiation. And not
That's
chemo.
so interesting. Yeah. It's crazy to me how we figured this out, that you can treat cancer in this way and target things so much on a cellular basis.
Right. And that's all due to research, right? That's why research is very important. That's why academic centers are very important. Most cancer treatments are done typically in countries in the community setting, right? Which is like what we're doing. But all the innovation comes from the academic centers, the universities. And then they disseminate that out, and then we treat the patients with that research. And that's what we do. I still try to keep a little bit of myself in both worlds, still doing research and still staying up to date. That's where we're able to deliver radiopharmaceutics. And just yesterday, we had our first treatment here in Southwest Iowa called the prostate SBRT treatment, where instead of multiple or 24 treatments or 36 for the prostate, you only get 5 treatments and you get a cure.
Wow.
Which is very convenient for some of the patients who don't want to come or live far away. And this is just from recent research. It just recently became into the open, but we want to deploy here in Shenandoah right away, and we have done that.
That's amazing. That's really forward thinking and being proactive.
Right.
So when you say that you're in both worlds, how do you stay up to date on what's going on?
So what I do is, first of all, for a long time, I sat as an editor for our journal for our field, Advances in Radiation Oncology. I did that for 5 years. I've recently stepped back, but I still send articles towards their way. and review as needed as well. And so by seeing the research and reviewing the papers and seeing what the papers are being submitted to me, I'm able to stay abreast of current developments in radiation oncology. Besides that, I still work with my friends in academic setting as a partner to help them with their research and to together put out publications. Just like that poster over there from like 2 or 3 years ago, or papers that we write. We just do them as often as we can, just to stay abreast and help us and help others at the same time.
Is there a website link for this where people can go view it?
Yeah, I'll send it to you.
Yeah, that's awesome. We will put it in the description of the video so people can check it out.
Yeah, 100%. Yeah.
That's awesome.
Yeah, that was called Checklist for Radiation Therapy and Planning, presented in Astro 2 years ago, 3 years ago now. It was very fun and used by residents across the United States and Canada for their education as they scan the patient, like I showed you last week.
Yeah.
A checklist that they can follow before you've internalized it completely.
So when you're looking at a patient like we saw last week, when that goes through your mind, are you just doing that mentally?
I'm doing
You're going through everything.
I'm watching the staff there as they bring the patient in there and set them up. And as they come back and press the button on the computer and they're using different tools, I'm running a checklist from my head, standing at the back to make sure that checklist is being completed.
That is a lot to manage all in your brain.
Yeah, so I used to, I'll be honest with you, for the first 2 years, carry a checklist and check it off.
I would.
Check it off as we went through each step, but now it's internalized, so it's easier just to follow.
Do you have any advice for a new person who's been recently diagnosed with cancer that's going through this journey? Do you have any advice for them as they start this journey?
Well, first I would say to them, you're not alone. There's many people ahead of you and behind you who also get diagnosed with cancer. It's 1 in 2 Americans in their lifetime.
That is a crazy statistic.
Right? A lot of people don't know this because they're not on the other side of the table. 1 in 2 Americans in their lifetime of the current cohort that are alive will be diagnosed with cancer sometime in their life.
Wow.
And the good thing is research and technology and development has become so good that survival has never been the greatest. This has been the best time to be someone who has cancer, because the tools that we have are the best. The people are surviving, they're living longer, and more importantly, they're living longer with less side effects, right? Because you could live, but if you have poor quality of life, what kind of life is that, right? So people are living better lives, living longer with less side effects. And that's from research that scientists are doing, MD, PhDs are doing, and all the other wonderful scientists out there to make sure we have the new treatments available and providing them to the people. So you're in good hands. Shenandoah is actually great. We provide excellent care, compassionate care locally, so you don't have to make that 2-hour drive every day. A lot of my friends work at these places now. We kind of know each other. We go to dinners. We kind of know each other, just to let you know.
Well, you have a community. That's how you stand for.
Oncologists, right? Especially the ones in Omaha. So we kind of refer patients based on their convenience, to be honest.
That's great. But I thought it was really cool that they were like, no, you need to go, like Shenandoah has the perfect location for you to treat your cancer. Like this is where you should be. And so they sent them to Shenandoah, which
we see that every week.
That's
they get referred somewhere else, they get sent back here, which sucks for the patient because they have to go 3 spots unless they're kind of self-aware and they're like, hey, well, there's a cancer center here. Can I just go there? And they skip steps. Yeah. But sometimes they go around and they come down here.
We're working on changing that.
Which is unfortunate.
Yeah, well, we can definitely work on getting more education around that for sure. But that's great that this has turned into such a hub, really, for cancer treatment.
For a rural setting, we really do deliver quality care. And equally important, compassionate care. Make sure that the patient doesn't feel like a number, and making sure they don't feel like they're only a diagnosis to us. And that's very important. Yeah. I
think the community itself appreciates that. And it is one of those things where you're in a small community and most everybody knows most everybody. So when you're coming in, you're seeing somebody that, you grew up next to as a kid. You're seeing your, son's friend's mom in here. You're getting that, oh, I see you everywhere else too. You're my neighbor. You're part of my community. I know you. You're my friend. So it's a little bit easier to feel cared for and to have that level of connection.
Right. It's funny. I follow on Facebook the community buzz page or whatever they have for Shenandoah. Very funny comments most of the time. Some weird people, not gonna lie. But it's also interesting to see how people talk about when someone has cancer or some diagnosis, where they send them to. It's very insightful to see what they write there or what they write about our hospital. It's just, for me, I just use it as a way to kind of keep a pulse on the community and see what their thoughts are. But definitely, for sure, when there's a cancer diagnosis, it seems like everybody wants to go, obviously, get the best care where they can as quickly as possible.
Yeah.
And that's what patients are value to be important to them.
Yeah. And it's so comforting, really, knowing that you can get the best care at SMC. Like,
right.
That's mind-blowing.
Interestingly, so most of the patients we see anyways here, you would think they'll be from Shenandoah, but obviously Shenandoah is not a metropolis. So we see a lot of people from around the community around here, 1 hour distance, all the way from Clarinda, Red Oak, even and further out. So it's not only local Shenandoah. The hospital is, yes, in Shenandoah, but we see from all of Southwest Iowa, northern Missouri.
Yeah, I definitely know there's been
Southeast Nebraska, right? So it's very interesting.
Close.
Very interesting. You see a whole combination of people here.
Definitely. I almost think that's makes it more of a hub here, because it's Shenandoah is kind of at the central location where it is kind of like the spot before you have to drive an hour and a half to go to a bigger city. So the convenience of these smaller locations that can just be like, we'll send you to Shenandoah. Right. They can take care of you. They have everything that you need right there, versus you're going to have to drive, an hour and a half, 2 hours away.
Yeah. That's the convenience we look at for sure.
Do you have any kind of special message or anything you want to say to the SMC community?
Yeah, I think the community is very special. We get care here ourselves for my family too, because we believe in the excellence of this hospital. My wife comes here, I come here. I'm like, my kids get imaging here as needed. I really like how fast things are done here, with quality in mind and compassionate care. So for the patients that come here, we'll take care of you, and we'll take care of you from A to Z, because we are part of this community, and we're here for you. So that's the message I want to leave.
I love that. Do you have anything that you think the community should know about Dr. Mel, without regards to being a radiation oncologist, which is cool enough in its own right?
You might see me stopping for dogs and cats on the community. I've done that often. And making sure they're safe, that's very important to me, like other animals and pets.
Yeah, and like animal rescue.
Yeah, just because I feel like sometimes, because they don't speak, they can't speak at our level, they get their care ignored. So I hate to see a cat or a dog on the road loose. So you might see me chasing them down, like it happened 2 weeks ago here down the road. I saw a dog running into the main road here, back and forth.
No.
And I was like, this dog is going to run over. So I kind of followed and kind of stopped and grabbed him and tried to find who it belonged to. So you might see me doing that. I've done, it happened 3 times. I find a lot of times here, dogs are running loose.
Get out or
but it happens in smaller communities. So it happens where I live too. But yeah, I really love animals. We run a small, rescue for older horses.
Oh, that's awesome.
My wife and I, and we take care of that. That's a big passion of ours.
I didn't take you as a horse guy.
Yes. I know. You can't. I know.
I only say that because I'm like, the Star Wars, like all of that, the super science fiction, it just, to me, I associate like horses are more on that,
Well, most mornings start in the barn for me, just to let you know. Most mornings start in the barn. I like that. It's like a little bit of peace, quiet, and kind of chat with the animals. Not a crazy guy, but
hey,
I think they listen.
I think they do too.
I think they listen. And then kind of get my day going. So that's most, 7 days a week, which I really enjoy. And then at the end of the day, I go around feeding the 10 cats around the house and outside. And now we have that Count Chocula.
Count Chocula.
It's like some of my highlights of my day. So I really love animals, and I feel like they bring great quality to our lives, and it's like a God's gift to people. You know?
I would 100% agree with that. I never knew. That's a new thing I learned about Dr. Mo today. I've been around horses. I love horses. I think I knew how to ride a horse before I knew how to ride a bike.
Yeah, you told me that last week. That's why I was kind of asked you.
Yeah. They have this sense of knowing. I'm sure you've ridden.
Yeah.
And there's just something that, like, when you're on a horse and you're sitting there, they feel everything you are feeling. And in order to be in control, you have to calm down.
They're smarter and more emotionally sensitive than people give
100%. They know it all, and they can sense things. And while they can't speak per se, I feel like they still speak really well with their eyes, with their ears. I always watch a horse's ears to know what's going on.
Yeah, right? Exactly.
You can tell if they're like elevated, if they're
excited,
just based on the ears and the position of their ears.
They're waiting for their food, if they're excited.
Half the time, if they're waiting for their food, they're screaming at you. But
yeah.
Thank you so much, Dr. Mo, for giving me an hour of your time. Really excited to share this with our SMC community. That wraps up this episode of The Care Connection, a little behind-the-scenes look at SMC. Thank you so much for listening and being part of the Shenandoah Medical Center community. You can follow us on all the social media platforms to keep up with the latest news, what we have going on, and different wellness resources available. We will see you next episode. Thanks again for listening. If you're interested in getting involved, you can sponsor an episode of The Care Connection, and all proceeds go to fund the SMC Foundation's car seat program. For more information, you can contact me, Chelsea, at 712-246-7074, or feel free to email me anytime at cjuarez@smchospital.com.